In the oral healthcare world, diabetes mellitus can create limitations and barriers to treatment, healing, and increase the risk of dental disease. Oral findings associated with diabetes can involve increased gingival inflammation, periodontitis, attachment loss, increased probing depth, bone loss, tooth mobility and migration, xerostomia, and delayed healing mechanisms following surgery, while overall increasing the risk for infection and disease. People with diabetes may also experience diminished taste, benign oral ulcers, burning mouth or tongue, chronic mucosal inflammation, and darkened pigmentation of the neck. Poorly controlled diabetes can increase the risk of caries related to heightened glucose levels of gingival sulcular fluid, decreased saliva, and dietary intake. Well-controlled diabetes can decrease risk for caries with regular or low sugar eating habits, meticulous dental oral self-care, and regular dental hygiene appointments. Systematic reviews suggest patients with diabetes are at a 2 to 4 times greater risk for severe periodontal disease. Evidence indicates those with diabetes have a higher hemoglobin A1C than healthy individuals. Intervention of physical activity, weight loss, and lifestyle changes may assist the management of periodontitis in addition to lowering hemoglobin A1C levels. Appointment planning for patients with diabetes should be structured around stress prevention to avoid disrupting blood sugar levels. Patients with a well-controlled diabetes status may continue with routine dental treatment as normal. Patients with an uncontrolled diabetes status may be declined routine dental treatment until the patient's condition is stabilized. Emergency care may be given in addition to ensuring the patient's primary physician is consulted. Appointment timing should be avoided during peak insulin levels and is generally preferred following the patient's breakfast and medication intake during the ascending portion of blood glucose levels. Dental hygienists can prevent and prepare for emergency during the patient's visit by ensuring to keep the appointment short, efficient, stress-free, and catered around the patient's diligent eating schedule. Additional precautions may be implemented by monitoring symptoms of hypoglycemia, treating all infections promptly, and preparing for a hypoglycemia emergency by keeping glucose gel available. The patient plays a critical role in self-management while living with diabetes. As dental hygienists, we emphasize the need to be compliant with lifestyle modifications, including healthy eating, physical activity, weight management, glucose monitoring, tobacco cessation, meticulous oral self-care, limiting or avoiding alcohol, stress management, and appropriate use of prescribed medications. 11 million Canadians are living with diabetes or prediabetes. The chances are that you or someone you love is affected by the disease, and this is the reason we must continue the fight. Donations can be made to Diabetes Canada to continue helping people with diabetes in your community live healthy lives and bring humanity closer to a cure.
Created using Powtoon.